Hello guys, look at this terminology, antepartum hemorrhage. What is ante? Ante is before, right? Partum is the labor. So before the labor, any hemorrhage, bleeding. So that is what is antepartum hemorrhage. Let us look at the definition of antepartum hemorrhage. It is defined as bleeding from the genital tract or into the genital tract, okay, after the 28th week of pregnancy, but before the birth of baby, okay. So here you have the birth of the baby, here is the pregnancy period, and here is the 28th week of pregnancy. So from this time, 28th week of pregnancy till the birth of the baby, if there is any bleeding from the genital tract or into the genital tract, okay, that can be the antepartum hemorrhage, okay. What do you mean by from and into the genital tract? So it might have not completely come out, but it is in the genital tract, into the genital tract, so it can still be antepartum hemorrhage. But if it is from the genital tract coming out, it can still be antepartum hemorrhage. Then what do you call bleeding before 28 weeks? Because you should understand that too. This is just a definition video, but yes, what is it before 28 weeks? So here you have 28 weeks of the pregnancy. Before it, if it is bleeding, you can consider it as an threatened abortion, isn't it? It could be a threatened abortion. If the os is closed, if the cervical os is closed, or it could be a miscarriage, right? Or it could be a complete abortion or an incomplete abortion, right? Missed abortion. So many terminologies are there for all these types of bleeding. There is something called as spotting. Okay, there is something called as bleeding. So what do you mean by spotting? Spotting is something where the person doesn't need a pad. A sanitary pad is not required. However, bleeding is something where you need a pad. Okay. Now then the childbirth happens when you have the labor, when you have the delivery of the baby. So beyond that, whatever bleeding, you will, if it is excessive only, you will call it as postpartum hemorrhage, right? Postpartum hemorrhage. And then in the puerperial period, she will be passing some kind of discharge that is called as the lochia. Lochia will have red color. That time, if it is red color, it will be lochia rubra. Okay. So this is all during the pregnancy, let us say. Okay. You have understood that what is in the initial part of pregnancy, what it is in the later part of pregnancy, right? So there are a lot of bleeding itself has so many things, considerations. If it is before the pregnancy, what and all you have here, you have normal menstruation, and anything abnormal in the menstruation can be considered as an abnormal uterine bleeding, which you have seen in the abnormal uterine bleeding video. Basically, less bleeding also is abnormal, more bleeding is also abnormal. So there you have terminologies like polymenorrhea, menorrhagia, polymenorrhagia, right? So many terminologies are there under AUB. Our intention in this video was only to look at the definition of this terminology called as antepartum hemorrhage. So antepartum is, well, she's pregnant, and that is after the 28th week of pregnancy. Okay. What are the causes of antepartum hemorrhage? It can be placental bleed. The bleed can be coming from placenta. It can be a placenta previa or an abruptio placenta. Placenta is separating early, right? Placenta previa is something like it is blocking the exit, right? So it will be passed by, it is blocking the exit, can be a cause of the bleed, right? Then there can be unexplained causes for a pregnancy bleed, right? After 28 weeks of pregnancy, that is. So basically, where are we? Here. So basically, there can be unexplained causes and extra placental causes like cervical polyp, carcinoma, varicose veins, and local trauma. Main thing you have to remember here is whenever they talk about antepartum hemorrhage, you will talk about placenta previa and abruptio placentae. Basically, placenta previa is nothing but it is blocking the exit, the placenta itself. So there can be bleeding in these cases. Here you can see placenta, abruptio placentae. Here you can see how there's a bleed within, right? You cannot, externally you cannot see it. So it is like more like a bleed inside, right? This is the concealed type. Here you have a revealed type. All these are revealed only, isn't it? And then here you have the marginal, that's subchorionic, and this is preplacental subamniotic. So all these are the causes of antepartum hemorrhage. Okay, so you have understood this terminology, antepartum hemorrhage. If they ask you APH, antepartum hemorrhage, you will just write two things. Definition you will write, and the cause you will write placenta previa abruptio placentae, over.